as of 12:29 a.m. today, St. Kitts and Nevis recorded one additional case of COVID-19, and this brings the total number of confirmed cases to 11. The patient is a 35-year-old male who is a citizen of St. Kitts and Nevis and resident on Nevis. He's employed in the tourism industry, and as such, the case can be described as import-related. The distribution of confirmed cases in the Federation is now as follows: 7 cases on St. Kitts and 4 cases on Nevis. In the Federation of St. Kitts and Nevis, there are to date no deaths attributed to COVID-19, thanks be to God. To date, however, some 183 persons have been tested with, as I indicated earlier, the 11 confirmed positives, 114 confirmed negatives, and some 58 results are pending from CARFA. There are currently 34 persons quarantined at a government facility, while 224 persons are quarantined at home. 11 persons are in isolation, and obviously these 11 persons are the persons who would have tested positive. To date, we have 285 persons who would have been released from quarantine. Please be assured that our community health workers are constantly working to prevent the possibility of community spread, and this is being ably done through the efforts at in-depth contact tracing and monitoring. The Ministry of Health would also like to take this opportunity to remind the public that while we are under this current state of emergency, we are still encouraged to work together, as every single other speaker has said this afternoon, to reduce the impact of disease on our nation by adhering to the policies in the Emergency Powers COVID-19 regulations. Persons with a confirmed diagnosis of COVID-19, you are to remain in strict isolation. Persons who have had significant and direct contact with a confirmed case are automatically placed in quarantine. Please note that you are required to remain in quarantine for a minimum of 14 days. Persons in quarantine are not allowed to interact with anyone during those 14 days. And out of an abundance of clarity, the Ministry of Health also wants you to know that just because you would have counted off 14 days, it doesn't mean that you now have your free paper and you can come out. You still must be screened again and tested to make sure that you're in the clear, because we have a number of persons asking questions along those lines. I also wish to use this opportunity this afternoon to provide a brief update on the emergency meeting of COSAD that was held today, April 6, 2020. Now, for the benefit of the public, COSAD is one of several quasi-governmental cabinet segments within CARICOM, and it stands for the Council on Human and Social Development. In terms of COSAD, the lead Prime Minister is our own Prime Minister. The current chair of COSAD is the Honorable Minister of Health for Antigua, the Honorable Malwin Joseph. Now, here are the key takeaways from today's meeting. 1, we are facing, as we have heard on the news outlets all over the world, that there's a global shortage developing when it comes to test kits. We are now facing a dilemma where, on the one hand, the WHO and other premier world agencies are telling you test, 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 which is what we need to do. But at the same time, there is the reality dawning that test supply would be an issue. However, we reiterate that we reserve testing for persons who are suspected cases. And in our jurisdiction, as with the rest of the world, 95% of the transmissions are coming from this group, the group that has the suspected cases. Only 5% of the transmission is coming from persons without symptoms. We would hopefully get to a point where we will be willing and able to test even the asymptomatic ones, because it also means that during the time of the incubation period and beyond, you could have a situation where you have no symptoms, but then you might be contagious to others. So herein lies the requirement to stay in your quarantine and to stay in your isolation, as the case might be. Now, the global shortage that is developing as it relates to testing is impacting us in the region. And for clarity and as a reminder, our premier facility, our laboratory that confirms cases of COVID is the Caribbean Public Health Agency. And of course, these tests are PCR-based tests. These are not the rapid tests you're hearing about, those coming out of China, which has received so much press. These are confirmed laboratory protocols where every step is taken to give you as detailed a pathology as possible on the samples that are sent, in order for us to come to you, as needs be, to tell you whether a case is confirmed or not beyond a shadow of a doubt. Now, as a measure of comfort, I should also report that today's meeting would have informed the membership that some 1 million test kits have been ordered by PAHO to be used on the people of our region, that's the English-speaking Caribbean, as well as Latin American countries that are covered by PAHO. And these supplies will begin drop shipping into our member states as of next week, but of course you can appreciate that it's a large order, so it will be done on a staggered basis. So that is some good news that we are keeping our fingers crossed on. In the interim, CARICOM, PAHO, and CARFO will be issuing separate media statements on the state of play in the region as it relates to testing and supplies. And while I'm on this note, I should also indicate that much in the same way we have experienced it here in St. Kitts, the rest of the region is going through a similar phenomena, which is the pandemic of fake news. And that is permeating all throughout the region. It is something that CARFA and PAHO and the WHO is very concerned about. We would wish people to cease and desist because people are already fearful. None of us alive right now have ever been through a pandemic. The last one was 1918, so unless you're a centenarian in this room, chances are you would not have experienced that. But the fact remains that you always have to be in a fight with wrong information to overcome it with the correct information, so that the unnecessary fears that are being promulgated as a result of this fake information could be put to bed. So we want to make sure that we indicate that to the people of the region. And while I'm on that note, I would also re-emphasize, as has been done in several days, that this government will not compromise the health and safety of our citizens by using any test kits coming out of China, because of the abundance of media reporting that tells us how problematic they are. We are not prepared to gamble with the health of our people in this regard. So I just wanted us to note that. The UWI, who is a partner in our regional response, the University of the West Indies, has also been assisting the requisite ministries of health throughout the member states in terms of developing a matrix which is looking at the regional health and demands on our healthcare infrastructure. We would have seen the first layout of it today. We are looking forward to receiving it in the PowerPoint format that was issued today, so that CMO Laws and the rest of her task force can begin from tomorrow morning to begin to see how we can populate that matrix with our own specific information as it relates to St. Kitts and Nevis. We are advised that on a daily basis, once the matrix is populated, based on the data we are showing in terms of confirmed cases, negatives, persons released from quarantine, number of hospital beds available for isolated cases, then they will be able to do projections in terms of rates of infection, whether or not member states might have to consider helping out each other if you're in close proximity, because everybody is at a different capacity when it comes to resources, including hospital resources. So it's even down to that level. Projected spikes in the infection rate. For example, today we would have seen some comparatives as it relates to Italy, Singapore, the UK, the US, and then 2 Caribbean states would have been pulled out, for example, and those would have been Jamaica and Trinidad. And essentially, it is telling us if we don't stem the tide of the infection, we might see that same type of skyrocketing trend that we have already begun to see in parts of Europe. So we have to be very careful, and one of the ways we can do that, and the most powerful way, is the social distancing, and if necessary, lockdown periods, so that you could stem that tide that is coming our way. Now, of course, like anything else, the UE matrix also looks at the rates of death. we don't want to ponder that reality, because while we understand that we will have cases increase and people will get ill, we are still hoping in the Ministry of Health that those cases will be mild cases and the St. Kitts and Nevis would not have to lose any of our citizens. But to do that, everybody must do his or her part. Now, presentations were also made today by CDEMA, by Impacts, and by the RSS. And these presentations were more or less combined because of the interlinkages of the three agencies. And of course, it would have looked at risk assessment and security plans for the region, including but not limited to, especially now that you've heard of heads of government being in hospital, as in the case of Boris Johnson, dignitaries, people who you thought may have been immune to COVID-19. The data is showing us that COVID-19 is a great leveler. It is no respecter of persons, anyone can get it. But basically, CDEMA, Impacts, and the RSS would like us to begin thinking about crisis management and planning. What happens if, let's say, for example, your chief of police gets ill? Your mechanism for your high command must be ready to step into high gear. If something happens to your president or prime minister, cabinet must be able to function, government must be able to be ongoing. And these are very real things to ponder. And we can even break it down to the level of the family. You might have a family of 5, and that family of 5, it might be led by a breadwinner who might be the father or the mother. If one of those persons gets sick, then what happens to those children, depending on if they're small children? What type of social safety nets are we building into the system to make sure that even as we know we are confronting a beast whose dimensions we can't wrap our arms around, we can begin to build in resilience in everything that we are doing. Now, CARICOM would also want us to remind ourselves and our citizens, our friends, our families, that even as we are addressing the challenges of COVID-19, we are not putting issues such as non-communicable diseases on a back burner. Our non-communicable diseases represent 83% of the deaths in our federation. Those are persons with diabetes, hypertension, heart disease, other chronic illnesses such as kidney disease. And of course, the data is showing us more and more that it is those individuals who, if they have the misfortune of contracting COVID, might suffer more severe symptoms than persons who do not have these pre-existing conditions. So we are called upon individually and collectively to make sure we become and remain our brother's keeper in looking out for persons with NCDs, because it is something that is still dogging us and we have to get a handle on it. Other areas of concern with underlying conditions are persons with asthma and other respiratory type ailments, because let us not forget, COVID-19 is a respiratory related infection. It affects your breathing, it affects your lungs. So in closing, what I would want us to remember is all of what the medical professionals are telling us. Vigorously exercise social distancing as far as you're possible. If you don't have to go out, even when you have partial curfews, stay home, stay home, stay home. At the same time, practice hand hygiene, good hand hygiene, frequent hand washing, sanitizing with a sanitizer if water and soap might not be available, and using the appropriate respiratory hygiene measures. What do we mean by that? Coughing properly, sneezing, and also the way in which you blow your nose and discard of the tissue, or you sneeze or you cough into the crux of your sleeve. So these are some of the things that we would wish people to be reminded of. In closing, in light of the 3 presentations that we would have had this afternoon, we are also extending gratitude once more to the persons, the agencies, the corporate entities, and our diplomatic allies who have come forward to assist the Federation in this time of crisis. I'm particularly pleased with the donations announced today, those from Amory Bakery, those from Theodore Prince Brown, which is telling us that even ordinary citizens can do their part. And I think that presentation from Mr. Brown today was a powerful presentation, because there are people out there who tell themselves, I'm not a rich person, what can I do? You might not be able to donate your time because of the safeguards we have in place to guard against infection by coming and volunteering at the hospital, but you can give in kind. You can contribute in your own small way. And of course, the resident Taiwanese ambassador, His Excellency Tom Lee, we would have clarified his earlier donation that would have been announced in a prior release from SKNIS. So we are all grateful for these announcements. And again, if persons are interested in donating but you're not sure what to give, you can call us at the ministry, relay a message to 311, which is the hotline, or you can go on the website www.covid19.gov.kn, pull down the button that says contact us, and send us a short email. Thank you for your attention.